Hi John, how do you do? You had talked to me earlier about your hip issue, and we spoke a little bit about the hip flexor and the psoas and the idea of getting some hip mobility and working on your range of motion as well as doing some light strengthening exercises. I'd send you a program, and what the program highlights first is the muscle groups that we're going to use, and we're going to be using the hip flexor, the psoas, the gluteals, the hamstrings, the adductor, and the abductor. So just really quickly the hip flexor and the psoas connect from the inside of the leg to the back of the pelvis, and what they do is they serve for hip flexion. So anything like picking the knee up or hunching the torso down, you'd be activating your hip flexors. The hamstring is the large muscle that attaches from the back of the knee to right beneath the glute on the back of your leg, and the gluteal is your butt, so your gluteus maximus, the big hunk of meat on your backside, that's the gluteal. The adductor and the abductor serve for extension and flexion of the knee at the hip. So what we're going to talk about here is the vocabulary. Now the vocabulary section is basically your exercise reservoir that I want you to pick from, and we're going to go over each one of these and talk about the terminology and the specifics of each exercise. So the first one we're going to see here is called the clamshell, and we'll just go over really quickly. A lot of these exercises are done from the lying position or a quadruped position, being on your knees and your hands. So the clamshell, what I want you to do is be lying on your side, and you can have your arm just beneath you right here to give you a nice easy rest. Your legs are going to be bent at about 90 degrees with your heels right beneath your hips. And what I want you to do with the clamshell is just put your hand on your hip, and you're going to open that hip up and close it right back down. So as you open this hip up and keep it right back down, I want you to make sure that your heels are right beneath your hips and that your heels maintain contact with each other. So I don't want you to pick the whole leg up and open up. I want you to stabilize your pelvis so that you're moving only from the hip and not just rotating your pelvis up. So really isolated, opening up and closing it, and we're going to come back down. You can just flip around, switch sides. Again, arms right beneath you, my heels beneath my hips, my legs are bent at 90 degrees, and I'm opening the hip up and closing it. And as you do this, I just want you to slowly work on your range of comfort while you're thinking about stabilizing your pelvis nice and steady. Again, not opening up and rotating your torso, but just working directly from your hip. Okay, so that's the clamshell. The next one we're going to do is called the hip bridge, and this is a very important one for your lower back, and it really activates your extensors of your hip. So the first thing I want you to do is be lying on your back with your heels right beneath your knees. You're going to have your elbows pinned right down close to your sides, and I want you to pull your shoulders down and back. And from this position, you're just going to drive through your heel, picking your hips up so that everything's in a nice line. So I have my knee, my hip, and my shoulder all in a straight line. And I want you to start by holding here for about 10 seconds in extension. And then you're going to come all the way up and all the way down, nice and slow for 10 full repetitions. Very important, John, that when you're doing this hip bridge series, you get full extension so that you can really activate your glute and your hamstring. And this is also going to serve to stretch your hip flexor, which is giving you a lot of problems. Okay, so nice and easy again from the bottom, shoulders down and back, elbows are pinned down, and we're going to come all the way up and all the way back down. Okay, so that's the hip bridge. The next one we're going to talk about is abduction. Abduction. So you can be side lying again, and what I want you to do is have the bottom leg bent at 90 degrees. Your top leg is going to be straight, and you're just going to raise that leg straight up. Again, just like the clamshell, keep that pelvis nice and steady. I don't want you jacking your hip up and opening up, but keeping that hip closed and just working on that range of motion. Again, if it's giving you problems and you're feeling some discomfort when you're doing this, work on a smaller range and then slowly start to build on it. Okay? So that's the abduction. Side lying internal and external rotation of your hip. This is a very important one for hip mobility. We're going to be in that same position with the bottom leg bent. And we're going to start with our heel on the ground. So if you look at me here, I'm opening my hip up and I'm having my heel on the ground. And from there, I'm going to rotate my hip internally and touch my knee. So I'm going heel and knee. Heel and knee. And I'm just opening the hip and closing the hip. Heel and knee. And then again, you can just rotate around and switch sides there. Quadruped series, another really good one for hip mobility. So quadruped, all that indicates is that we're on our hands and knees. And the first one we have here is called the kneeling opposites, or the bird dog. So the kneeling opposite is just raising the opposite arm and the opposite leg simultaneously. So from this position, I'm going to start to bring my arm up and my leg up, getting a full extension of my hip, and then coming right back down and right back up. Okay? As I go, I'm trying to get that leg nice and straight, and just like the hip bridge, I want to make sure I have full extension of my spine so I can really activate my glute and my hamstring, and that'll give you a really good stretch through your hip flexor as well. Fire hydrant series. So, aptly named fire hydrant series because you've seen dogs lift their leg up to pee on the fire hydrant. What we're going to do is, again, on the quadruped, we're just going to start with the straight leg lift. So my leg is going to be bent at 90 degrees, and I'm just going to open my hip up and right back down and up and down. Again, one of the overriding themes with all these hip mobility exercises is that you're stabilizing your pelvis, keeping it nice and steady as you're moving through that range of motion of your hip. Don't worry, like I said, with the range of motion, I'd rather you keep your pelvis steady and work on a smaller range than start to open that entire pelvis up, and now you're not really working on that isolated range of motion through your hip.